Hey guys, I did a slideshow slash PowerPoint on myocardial infarctions, or better known as MIs. Basically, what a myocardial infarction is, it's also known as a heart attack, is when the coronary arteries, which are arteries of the heart, are blocked up by a mixture of blood clot, fat, and cholesterol. This blockage in the arteries interferes with the blood flow to the heart and stops the flow of oxygenated blood and nutrients from getting to the heart muscle. Um, that's basically like us being unable to breathe, I guess you could say. The lack of oxygenated blood flowing to the heart, it's called cardiac ischemia and literally means death of heart muscle. Um, This can damage and even kill the muscle tissue of the heart and can be fatal to the person experiencing the MI. Um, some things that cause MIs are cardiovascular disease, which basically means that you have high cholesterol or high blood pressure. It can be caused from other things as well, but that's mainly going to be the two main contributing factors to what would cause you to have a blood clot. The next is going to be the two different types of MIs that you can have. There's one that's more severe and then one that's less severe. The more severe MI that you could have is going to be a transmural MI, and then the less severe is going to be the subendocardial. It doesn't mean that you can't die from either one. You can, however, you have a higher chance of dying from a transmural. The transmural is also known as a STEMI. And basically, what it is, it's when the thrombus or the blood clot remains in the tissue or the affected part of the heart. And it actually affects all three layers of the heart rather than just one layer. So it's going to be the more severe due to the fact that it affects all three of the layers of the heart and kills it off. Um, this is basically shown in an EKG with an ST elevation, and so the baseline would be elevated. You can see this in the left-hand bottom picture that I have, where you can see that it goes up, and then you have that ST elevation that hangs there. A lot of people would call that a gravestone because it kind of looks like it. um, then you're also going to have your subendocardial, or what we like to call it, the non-STEMI um, MI, which basically is going to be your less severe. And that is when the thrombus or the clot is actually going to be dislodged from that area, and only the myocardium directly beneath the endocardium is going to be affected. So it's only going to be one layer being affected by the clot rather than all three. So that's obviously going to be less damaging to the heart. This is going to be shown in the bottom right hand picture where you can see it spikes, goes down, and it goes down farther than where the baseline was and kind of hangs there for a second and goes back up. So that's going to be your ST depression, which you would see on a non-STEMI MI. So the signs and symptoms are fairly similar, although men and women can have some differences in the signs and symptoms that they're having. Men are going to have a lot more chest discomfort. They can have some arm pain as well, right over their deltoid. They're also going to have, so women are going to have more nausea, vomiting, jaw pain, and back pain. This will be pain that radiates from their chest up through their neck and jaw or over their shoulder and down their arm. Um, Something that both of them will have, they'll have that sudden severe chest pain, and a lot of them will say it's like a big, tightly squeezing feeling, like they have a belt wrapped around their chest, or like an elephant is sitting on their chest. This pain usually radiates to their back, neck, jaw, shoulders. Just depends on the person. Um, People who are having an MI, you're going to know that they're going to be really sweaty, as we like to call it, diaphoresis or diaphoretic. They're going to have dyspnea, which basically means that there's shortness of breath. You'll notice that they're kind of huffing and puffing, trying to get more air in. You'll notice some extreme weakness, an increased heart rate. They could pass out, and also a low blood pressure. Um, so testing for this, if you came into a hospital or medical facility, they would hook you up to an EKG and take an EKG, check to see what your heart looks like while it's pumping, and then they would also check a troponin level, which is basically something that your heart puts out when it's in distress. Um, Treatment for this would be supplemental oxygen if your oxygenation is low, dietary restrictions depending on if you have high cholesterol. Um, if it's a very bad MI, they might bring you to the cath lab, put a stent in your heart to try to get that clot. Uh, they might do bypass as well. It just depends on how severe it is. Or they might just put you on medications that would open up those arteries and allow for clots to go through. Um, all right. Well, thank you guys so much for listening, and I hope you enjoyed.